as fluid therapy is always a really interesting question. So thinking about how has fluid therapy changed? I graduated from veterinary school in 1992. When I first started in emergency medicine, one of the big tenets of it was give a lot of fluids. If you're not sure how much fluids you should give more. And so in the 90s, we had a really big push of shock dose volume of fluids. So 90 mils per kilo, working out to one of those like 2-liter pop things for an Eversize 50-pound dog. So a ton of fluids. And so over the last 10 or 15 years, we've really recognized that too much fluids is more detrimental than we thought. And specifically what happens is there's swelling in the tissue edema that prevents healing, can prevent tissue function or organ function. And so absolutely some animals need a lot of fluids, but we've really moved away from give as much fluids as quickly as you possibly can to these dogs. And so that's been a really big change. And absolutely, we clearly give fluids, and fluids are important, but looking at them in response to that individual patient, how much are they responding? Are they blood pressure improving? Is their pulse quality improving? Not just an automatic 90 mil per kilo as fast as you can. That's one of the big areas. The second big area that's changed a lot is we went for a phase where we were very big fans of a drug called, or fluid type called colloids. And colloids are a synthetic fluid that has a synthetic molecule in it, basically a sugar molecule that helps keep fluid in the bloodstream. And so when they first came online or first were available to veterinarians, we thought they would really help dogs, or cats, that they would be really useful in getting volume status improved. And they do work well to improve the circulating volume in dogs, but what we've recognized is that they can lead to coagulopathy or clotting problems. They've been associated in people, and in one study in dogs with kidney injury, so having their kidneys that were working normally before develop complications. And they also are prone to volume overload, so that the volume is so good it doesn't leave like you'd want it to. And then finally those little synthetic molecules end up having to be broken down by the body, and they seem like they can gum up certain parts of the body as well. So we absolutely still use colloids to some extent, but we've stayed away from them a lot in more recent years because we've seen these detrimental effects that we initially thought were really good, and now we're recognizing as things that really aren't as good as what we were hoping for. So those are two really big changes in fluid therapy that we've seen. The other final one that's also interesting is for dogs and cats with kidney disease. We used to think we're going to, the same thing, give them a lot of fluids, give them more fluids, we're really going to flush out their whole body system by giving them as much fluids as we possibly can. And now we're recognizing that doesn't really help improve kidney function. They might urinate more, but it's not actually helping their kidneys. So we're backing down in that fluid as well. And so fluid therapy remains one of the most important things we can do for our patients, but kind of the big change in the last 25 years is less volume. So more conservative fluids, more titrated to that patient, rather than just as much as you can get in. So that's probably our biggest change.